Hi, my name is Kayla and I'll be your student nurse today. I'm going to provide privacy and then I'm going to wash my hands. Can you tell me your name and date of birth?
Jade Richmond, 12/16/98.
Okay, I'm going to check your wristband. Thank you. Today I'll be performing a head-to-toe assessment. It's going to take about 10 minutes, okay?
Okay.
Are you comfortable?
Yes.
Okay, I'm going to start by asking you, do you know where you are right now?
Yes. The
Okay.
hospital.
Okay. And can you tell me who the president is?
Nobody.
Okay. Patient is oriented ×3. Speech is clear. Posture is erect. And hygiene is appropriate. I'm going to start off by checking your head for any lesions. No lesions, bumps, or parasites noted. Now I'm going to ask you to close your eyes and then tell me where you're feeling at.
My forehead, left cheek, right cheek, my nose.
And then I'm going to ask you to smile and then frown and then puff out your cheeks. Okay? Cranial nerves 5 and 7 are intact. Now I'm going to check your eyes. Pupils are round and equal. Now I'm going to ask you to fan on my pen light. Pupils accommodate. Cranial nerves 3, 4, and 6 are intact. Now I'm going to ask you to open your mouth and say ah. Uvula is midline, tongue is midline, mucosa is pink. Now I'm going to ask you to swallow. Cranial nerve 9, 10, and 12 are intact. Now I'm going to check your ears if you can move your hair back. No lesions, cerebrum, or discharge noted. No lesions, cerebrum, or discharge noted. Now I'm going to tell you to close your eyes. Just tell me where you hear it, what ear you may hear something in.
Left ear, right ear.
Cranial nerve 8 is intact. Now I'm going to check and ask you to lift up your shoulders and put them down. And then I'm going to ask you to push against my face and push against the other side. Cranial nerve 11 is intact. I'm going to check your nose. No discharge noted. Then I'm going to ask you to hold your nose. Breathe in, and then the other nose. Nose is patent. Now I'm going to check the patient's breasts while she is not noticing. Breasts are equal and normal. Anterior, posterior is 1 to 2. Then if you could turn around for me. I'm now going to check the patient's spine. Cameraman, come follow. So the spine is aligned. And then I'm going to percuss. Tell me if you feel any tenderness. Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Okay, no tenderness. And then I'm going to listen while I'm here. And you can turn back around. Okay, now I'm going to listen to your heart. I'm going to start by listening to the aortic valve, second intercostal space, then the pulmonary valve, second intercostal space, Erb's point, third intercostal space, mitral valve, fourth intercostal space, tricuspid valve, fourth intercostal space. Now I'm going to ask you to lay on the couch. I'm going to listen to her bowel sound. I'm listening to her right upper quadrant, her right lower quadrant, left upper quadrant, left lower quadrant. Bowel sounds are heard. Now I'm going to palpate. Any tenderness?
No.
Any tenderness?
No.
Any tenderness? Okay. You can stand up for me. Do you have regular bowel movements?
Yes.
About how many?
3 times a day.
Okay. And do you urinate frequently?
Yes.
And when you urinate, is there any pain or unusual odor?
No.
Okay, thank you. And now I'm going to ask you to stand up and then go walk towards the end of that stand and then turn around and come back. Gait is normal and Romberg's test is negative. Now I am going to check your pulses. You can hang your hand up like this. Checking her brachial pulse, radial pulse, popliteal pulse, posterior tibial pulse, dorsalis pedis pulse. Now I'm going to ask you to take off your socks. I'm going to check your capillary refill. You can have your hands like this. Capillary refill is less than 2 seconds. Now I'm going to push on your arms. Don't let me push you down. Okay. And then I'm going to ask you to squeeze on my fingers. Okay. Now I'm going to check all your range of motions. So if you move your hand in a circle like this, then in a circle with your arms, and then your legs and ankles. Okay, now I'm going to check your extremities for any heat or tenderness. Okay, no heat or tenderness noted. This concludes the end of our head to toe assessment. I'm going to wash my hands and document my findings.